Hi everyone. In this clip, I will talk a little bit about oral hygiene. Just a reminder that anything I post here is not meant to diagnose or cure anything and are for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So when we talk about maintaining proper oral health, the focus usually tends to be on brushing, flossing, and using mouthwash. When it comes to commercial mouthwashes, they can have side effects, including irritation, dryness, and believe it or not, staining after a few weeks of use. On top of that, any type of mouthwash, whether alcohol-free or containing alcohol, can kill off a higher number of bacteria in the mouth, which are actually a part of what's called oral microbiome, which help break down the food and maintain healthy teeth and gums. Now, killing off all of this bacteria in the mouth on a regular basis is really not recommended. On the other hand, commercial toothpastes also have their own issues with ingredients like fluoride, which can cause discolored spots on teeth, aside from various other health side effects, including neurological and endocrine dysfunction. In 2006 and 2012, researchers from Harvard School of Public Health and U.S. National Research Council found a strong connection that fluoride may negatively affect cognitive development in children, as well as its effect on endocrine function. The endocrine is a system of glands that help control many functions within the body by releasing hormones and help determine how our heart beats and how our bones develop and grow, just to name a few, right? So, and of course, this chemical can accumulate in the pineal gland and cause calcification. And calcification of pineal gland can impair its ability to produce melatonin, which is a hormone crucial for regulating sleep cycles and other health issues like migraine and neurodegenerative disease, as the gland becomes less functional with the increased calcification. Another ingredient found in toothpaste is triclosan. Triclosan can also be found in body washes, antibacterial soaps, cosmetics, and according to FDA, a study that was conducted found a decrease in some thyroid hormones because of this ingredient. However, they feel there is no significant data yet on the effects of this in humans in relation to the study. Thyroid hormones help control our metabolism and keep it regulated. A decrease in such hormones could result in weight gain, amongst many other complications. There are also several studies investigating the link between triclosan and antibiotic resistance and developing skin cancer. Next popular ingredient is sodium lauryl sulfate, or SLS. I'm sure you have heard a lot about this in the past few years when it comes to shampoos and so on, as it can cause skin irritation and can aggravate canker sores. And the chances of this happening increases, especially if it is used over 3 months. For those who suffer from mouth ulcers, this could actually worsen the symptoms much further. Next in the list of popular toothpaste ingredients is propylene glycol. This is a colorless, nearly odorless, and tasteless thick liquid. It's used in many processed products because it helps them maintain their consistency, moisture, and texture. The chemical is usually made from petroleum. However, some companies are now making it from plants like canola and soybean. This chemical may show up in the ingredients under different names, and the two that I can remember off the top of my head is trimethyl glycol and methyl ethyl glycol. But there is more. This chemical enters the body if we consume foods or medications that contain it, breathe air containing a mist from it, rub it on our body using a cream or cosmetic, and of course, toothpaste or mouthwash. Propylene glycol has been linked to central nervous system damage as well as liver and heart. For individuals who have kidney and liver disease, these effects can be more severe as the breakdown process might not be as simple. Propylene glycol can be found in items we use daily, like cosmetics, flavorings, bath products, sauces, dressings, prescription drugs, even in foods we eat for pet foods and treats that we feed our pets. The next ingredient that might be found in toothpaste is artificial sweeteners. There are many studies on the effects of artificial sweeteners on the body, from bladder cancer to brain tumors and lymphoma and weight gain and metabolic disorders and general gut health issues, insulin resistance, and a whole lot more. Another ingredient found in toothpaste is something called DEA. This is a chemical that can be found in antifreeze or brake fluid. Studies back in 1998 showed that topical application of DEA is linked to cancer and caused deficiency of the liver, basically. So this is an ingredient that should not be found in our toothpaste or any other consumer product for that matter. Next ingredients are parabens. Parabens are used to preserve the shelf life of a range of cosmetics, including toothpaste. Parabens can disrupt hormone function by mimicking estrogen. In some cases, parabens can lead to breast cancer, as well as they have been linked to developmental and reproductive issues. Having said all this, please choose the products you use carefully. Every little bit of chemical we decrease in our daily life can add up to be a lot later. For example, you can make your own healthy toothpaste at home. I usually mix mine, and I do equal portions of calcium bicarbonate powder plus bentonite clay powder plus half a portion of baking soda plus teaspoonful of ginger powder, and mix this all with small amount of liquid coconut oil. Then I add sort of 10 drops of tea tree oil, 50 drops of mineral complex, a small amount of powdered probiotics, 100 drops of clove essential oil, 100 drops of peppermint oil. Mix the ingredients well, and it will last for a few months because you just need a nickel size of that to brush your teeth with every day. And when you finish brushing, you actually feel like you have just walked out of the dentist's office. It also doesn't allow any plaque buildup or discoloration or anything like that. Also, just before you brush in the morning, doing like 5 to 10 minutes of oil pulling is awesome for the gum and general oral health. Oil pulling is an age-old Ayurvedic dental technique that has gotten attention for its many suggested health benefits. The process removes harmful bacteria and plaque from the mouth, exercises the gums, removes tooth sensitivity, and improves overall oral health. All you have to do is to swish around a teaspoonful of coconut oil or non-roasted sesame seed oil in your mouth and then spit it out after 5 to 10 minutes. Make sure you spit it out actually either in the toilet or in the garbage can because over time, it can clog your sink or shower plumbing. I found that the hard way. After spitting it out, rinse and brush your teeth. You will find your teeth feel better, your gums are healthier, and the tooth sensitivity is not there anymore. Hope this has been helpful. Like and follow for more. Be the light.